I'm Derrick Hall, President and CEO of the Arizona Diamondbacks. I've now been here. This will be my 10th season coming up. Before that, spent about 12 seasons with the LA Dodgers. Have enjoyed a life and a profession in Major League Baseball, and I am a cancer survivor, prostate cancer. There's a lot of fear out there when it comes to the robotic surgery, when it comes to Da Vinci. And I think really with any surgery. You know, before that, when you had the radical prostatectomy, I looked at those numbers and that method as well, and there's still some today that go through that same procedure. But for me, I think the Da Vinci made the most sense. I saw the success rate, certainly had faith in my surgeon, and there are so many good surgeons. You know, here locally, my urologist who performs the surgery, so many times a week, he's become a master, and they all have. And I don't think there should be any fear. If a patient has faith in his surgeon and in his doctor, everything will be fine. And that's a message that you really have to send to those that are looking at all the different possibilities. And when I have people that come to me and say, what should I do? I don't think it's my place to say, you should do A, B, or C. I think it's my place to say, look into all of them as I did. Do your due diligence with each of those different treatment formulas and come up with what is best for you and your family, what you feel most comfortable with. And for me to go visit with my surgeon, sit down with him, and my wife and I felt really good about the bedside manner, about the experience, about the care, about the concern, the compassion for the patient. It was a no-brainer for me. And I think too often you hear men should be checked when they're 50. I disagree with that, obviously. I wasn't 50 years of age. If I had waited till I was 50, it would have been too late. I think if you're 30, 35, 40, if you have a family history, go get tested. And there's a lot of debate out there about the PSA, for example. Government gets involved, medical society does not. And I would argue, debate, and fight any of those individuals that say that the PSA should not take place and doesn't matter, because the PSA saved my life.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.